I'm David Lombardo, and this is WCNY's The Capitol Press Room. This summer, the Hochul administration's Office of Victim Services is in the process of doling out funding to nonprofit service providers, but some of the organizations that have been historically funded in New York are bracing for major cuts from Albany that could further limit access to services for survivors of sexual violence, depending on where they live in the state. For more on those concerns, we're joined remotely by Emily Miles, Executive Director of the New York State Alliance Against Sexual Violence. Well, let's start by talking about the types of programs and services that have been historically funded by these grants from the State Office of Victim Services, including rape crisis programs. What can the range of services look like?
Absolutely. So it's important to know that these are federal dollars that get passed to the state for the purpose of supporting victims of crime. So these funds go to organizations supporting all types of victims of crime. You can think gun violence, domestic violence, sexual violence, everything in between. So this is a pot of funds that supports a wide variety of organizations. Historically, it has been the major source of funding for gender-based violence programs, so domestic violence programs and sexual violence programs across the state, including rape crisis programs. This is the main source of funding that they look to provide those services to survivors.
And rape crisis programs, what does that mean for a survivor? What can that experience look like from A to Z?
So, rape crisis programs are organizations that exist solely for the purpose of providing support to survivors who have experienced sexual violence. In order for an organization to call itself a rape crisis program in New York State, they have to be certified by the State Department of Health to provide certain services. So, for example, 24-hour response using a hotline for survivors that might call for help. Rape crisis programs respond to survivors that report to hospitals, often in the middle of the night and on the weekends. They send advocates to the hospital to be with those survivors and to help them navigate very complex systems that they have to face, like the criminal legal system, the hospital systems, and so on. They frequently provide counseling and supportive care to help survivors on their journey to healing. They do community outreach. They're in schools, training youth about healthy boundaries and healthy relationships. The rape crisis programs really are the foundation of survivor support in their local communities, working with hospitals, district attorneys' offices, law enforcement as experts in sexual violence response, and ensuring survivors are getting trauma-informed care that would help them on their healing journey.
Well, let's talk then about the support for those really expansive services, because it's my understanding that dollars are being doled out now. And while the Hochul administration hasn't made any official total tally public, you've been contacting programs around the state to find out what they've been told they're receiving, and you've been able to make some good guesses about the landscape of care moving forward. So what sort of trends are emerging? What are you hearing back, and is it troubling in any way?
Yeah. So, just a little bit of background on that. 2 years ago, the Hochul administration really invested in rape crisis programs. They had initially funded rape crisis programs from the state at $6.5 million. They doubled that funding to $12 million. We were elated by that. It was the largest increase of investment in rape crisis programs in many, many years. Additionally, they expanded supports for survivors. So previously in hospitals, if a survivor showed up to a hospital, hospitals weren't required to provide trained forensic examiners to work with those survivors. The Hochul administration passed a law saying all hospitals were going to be required in 2027 to meet a mandate that they have to provide trained medical staff to work with survivors, which is fantastic. And I have to be honest, groundbreaking. And the other states in the country are looking to us now because of the advancement in that law. But that advancement in the law has also increased needs for rape crisis programs, right? More survivors are coming forward with more complex needs, and rape crisis programs are stepping in to do that work. And it's important to note they are the only organizations that can step in to do that work. They are certified to do so. Other organizations aren't allowed to do that 24-hour response the way that rape crisis programs are. So they're the only ones that can do that. In this latest procurement cycle with OVS, we are seeing the largest constriction of investment in rape crisis programs in decades. So, based on the data we've been able to collect, we are now looking at a decline in funding of over $5.2 million in rape crisis program funding. So, at a time when we're seeing more survivors coming forward, more hospitals needing support, we are now seeing rape crisis programs having to pull back staffing. We've heard from rape crisis programs about what the impact of these cuts mean from them. They are looking at laying off staff, in some in really large numbers. They're cutting legal services. So these are attorneys that work with survivors to help them navigate the legal system, cutting support groups, cutting trauma-focused therapy, in some cases closing locations altogether. This is frequently happening, especially in more rural areas upstate, but also in urban areas. So in New York City, in the Bronx, we have 2 rape crisis programs in all of the Bronx, which is already kind of insane. One of the rape crisis programs is just getting up and running, so not providing full services. The other one was just completely defunded by the Office of Victim Services. So we're looking at the Bronx with the highest rates of sexual violence per capita, and we effectively have no functioning rape crisis program services in all of the Bronx as a result of these funding allocations. So that's what we're seeing now, right? So it's really disheartening and honestly going to be devastating for a lot of communities.
To at least some degree, that sounds reminiscent of what we heard in 2025 from some providers who were concerned about seeing a decrease in their year-over-year funding. And at the time, the State Office of Victim Services explained their rationale for funding allocations as essentially trying to spread the money around, trying to bring new programs and providers into the fold while actually increasing the total amount of money that was being spent. What do you think of that approach, assuming that is what we're seeing happen this summer as well, that they are funding new programs essentially at the expense of established programs?
So we are seeing absolutely needs of survivors across the victims of crime field increasing. And so we absolutely want those organizations to be brought into the fold. If New York State has decided that strategically they want to expand services to organizations supporting victims of crime, we enthusiastically support that because survivors should have options. Every survivor, regardless of where they live, should have a place to go for services. But if their plan is to strategically expand organizations that they are providing services to, they also need to expand the overall investment in funding for these services, right? So if you are spreading the same amount of money now across more organizations, you're just redistributing scarcity of resources. So again, if New York has strategically decided that they want to fund more organizations doing this work, that is fantastic. But you can't do that by defunding organizations providing state mandated services and non-duplicated services, because none of these additional organizations that are being funded are providing rape crisis program services. They're just not. And so you're taking money away from these organizations providing a critical non-duplicated service to spread it around to more organizations. And to me, that doesn't make sense strategically. Either expand the amount of funding going to this work or think about how you carve out pots of funds for these types of services like rape crisis programs that should exist in every single community across New York State.
In recent years, as federal support for victim services has waned, the Hochul administration has actually gotten some positive press for their commitment to stepping into this vacuum to some degree with state dollars. So how should we think about the state's approach to funding victim services like rape crisis programs, maybe compared to other states, compared to our neighbors? Are they making similar commitments per capita? Are they, I guess, stepping up to the same degree as New York is? Or are they saying to their providers, hey, you're going to have to turn to fundraising, you're going to have to turn to grants, and the state support is, I guess, just a part of the pie?
So, absolutely. And I have to give the Hochul administration a ton of credit on this piece. We have seen a decline in federal funds as a result of some policy decisions at the federal level regarding this funding stream, the Victims of Crime funds. And the Hochul administration absolutely stepped in and committed state dollars, $100 million a year, in order to fund these services. But again, that was $100 million to keep programs whole. We're not keeping programs whole. We are now spreading it across far more organizations. And so, in my mind, the original intent of those funds, again, was stability, and we're not reaching stability at this point. In fact, quite the opposite. When we look at dedicated funding for rape crisis programs in some of our partner states, if you look at Ohio, they fund just rape crisis programs through set aside funds at $15 million. They only have 31 rape crisis programs there. That's an investment of about $484,000 a program. In Pennsylvania just had a historic increase of set aside funds for rape crisis programs at $24 million. They have 47 rape crisis programs. That's about $511,000 per rape crisis program of set aside funds just for them. In New York State, we increased funds to $12.7 million 2 years ago. We have 54 rape crisis programs across the state. That's about $235,000 per rape crisis program. So when we're talking about dedicated funding for rape crisis programs, we are not keeping pace with our neighbors. And then when you add that to a disinvestment from this other funding stream, this Victims of Crime funding stream through OVS, we're not keeping pace with the cost of living. And as a result, you are seeing programs constrict their services more and more and more. And yes, some programs will close, but other programs will keep their doors open. But the services that they're going to be able to provide are so drastically limited to not be truly effective to the communities that they're trying to serve.
And after a quick break, we'll continue our conversation with Emily Miles, Executive Director of the newly minted State Alliance Against Sexual Violence. Support for the Capitol Press Room comes from O'Donnell & Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com. This is WCNY's The Capitol Press Room, and we're continuing our conversation about state funding for organizations serving survivors of sexual assault, and our guest is Emily Miles, Executive Director of the State Alliance Against Sexual Violence. We'll pick up our interview discussing the work of rape crisis programs in New York and the case for maintaining state support.
When we're talking about rape crisis programs across the state, we're talking about organizations that are working with people experiencing such intense trauma. We're talking about staff members that are getting phone calls at 2 a.m., sometimes driving 1-2 hours to a local hospital to be there with a survivor to ensure that they get connected to services and they get connected to a pathway to healing. Even before these cuts, we did a survey of hospitals across the state. We already know, based on current need, a majority of survivors are showing up at hospitals and not seeing trained medical staff, and they're not being connected to advocates, frequently because their community doesn't even have one, because, again, this lack of investment. We're not asking for the moon here. We're just asking for stable funding that allows these programs to do the work that their communities need. And we need the state to pay for that in a responsible way. There's not other funders for this work. Less than 2% of philanthropic funding goes to issues around women and girls. Less than 1% of that goes to gender-based violence work. There aren't other funders for this, right? When you're talking about services in some of our rural counties, we're not talking about a large pool of wealthy individual donors that can make massive donations to their local program to fund this work. The state is the funder for this work, and they have recognized, this Hochul administration has recognized the need to strengthen sexual violence services. We saw that in the sexual assault forensic examiner mandate with the hospitals. We saw that with an initial expansion of funds 2 years ago with the rape crisis programs. And we just want them to live up to that continued commitment as we move into this next funding year.
Well, what about the recruitment and retention of staff more broadly? Because we hear from nonprofits across the human services sector about their struggle to keep up with inflation, struggle to compete with what other jobs are paying. Has that been an existing problem? And is there any sort of relief coming in terms of COLA support from the state or something else?
Again, the folks that are working in rape crisis programs are just so phenomenal. These are people that are doing this work 24 hours a day. And frequently, when we ask rape crisis programs about, the average rate of pay, we're hearing $18 an hour, $20 an hour, $23 an hour. And these are trained, certified staff members doing this work. In comparison, if you look at Target, for example, hourly wages for retail associates in many parts of New York and upstate New York are $24 an hour. And that is more than many rape crisis advocates are earning in their communities. We believe that every job deserves, dignity and fair compensation. But we're talking again about rape crisis advocates that are being called out at 2 a.m, that are sitting for sometimes 6 to 8 hours at the bedside of a survivor in a hospital while they complete a forensic exam. These are folks that have to be experts in navigating hospital systems, prosecution, law enforcement, connecting survivors to housing, income supports, and trauma-informed services. These are experts in their field that, because they are so passionate about the work they do, they are willing to not afford vacations, not be able to afford sometimes a vehicle or reliable vehicle, housing. And on top of that, the state has provided cost of living adjustments for human services workers multiple times in recent years. And the gender-based violence workforce, the domestic violence and sexual violence advocates, year after year have been left out of those cost of living adjustments. You're having a workforce, a highly trained workforce that already doesn't earn very much money, being left out of cost of living adjustments, constantly being denied that. And so we're not even in the rape crisis field, we're not just competing against local retailers, we're competing against other organizations in the human services field, because even among like local nonprofits, our workforce is falling further and further behind. And so advocates leave their jobs. There's a very high level of turnover, and we can't blame them, right? People have to do what's best for their families, but at the end of the day, survivors suffer.
Well, with the time we have left, I want to come back to an issue that you and I have talked about in the past, although I don't think we've spoken on the mic about it since 2023, and that's the implementation of the state's Enough is Enough program, which is supposed to address services for sexual violence on college campuses. And I know in the past there have been concerns about the implementation of that law, whether all the colleges were complying with what was expected of them. Any sense of how things stand on that front in 2026?
Yeah, we love the Enough is Enough law. We love that it provides some level of resources for rape crisis programs to get on college campuses and work with students for both the prevention of sexual violence, but also the response to sexual violence. And just to be clear, it's sexual violence, stalking, and intimate partner violence that's covered under that law. And so it was groundbreaking when it was passed. New York State was absolutely a leader in this type of work in responding to gender-based violence on college campuses. We would love to see an update to that legislation. We know more now than we did when the law was originally put in place over 11 years ago. But also, the original funding level was $4.5 million. And over 11 years later, it is still funded at $4.5 million. Purchasing power has changed dramatically in the last over a decade. And so, yes, we would absolutely like to see increased investment because, again, we are seeing such increases in rates of violence on college campuses. When we work with our rape crisis partners who are doing work on campuses, rates of strangulation are going up dramatically, rates of intimate partner violence going up dramatically. And then we have a federal administration that's not providing the same level of guidance for college campuses. And so rape crisis programs are becoming experts on Title IX law and higher education law and providing that type of guidance to their local campuses in addition to survivor services. But again, aren't then getting the increased funds to do that the way that they know it needs to be done because that level of funding for so long.
And what about oversight and monitoring of this initiative? I know there are some responsibilities that have historically fallen to state education departments, some that might be the domain of the New York State Office for the Prevention of Domestic Violence. Do we have a clear and good sense of who should be administering and overseeing this, or is that an area that could be improved as well?
It absolutely could be improved. We work closely with the Office for the Prevention of Domestic Violence on this initiative, but they don't have oversight over colleges and universities. That's the State Department of Education. About a year and a half ago, there were surveys that were due to the State Department of Education from every higher education campus about the services that they provide and their alignment with the requirements of the Enough is Enough law. We have yet to see anything as a result of those survey responses. What percentage of campuses are complying? At what level? At the Alliance, we actually had to submit a FOIL request in order to get access to those data because we haven't then seen a final accounting for that. And again, when you have these requirements and you collect data and then you don't release it, makes it very difficult to hold some of these institutions accountable to what they are supposed to be doing. So we would absolutely like to see increased involvement from the State Department of Education in some oversight. And I would say as a next step, we mandate certain things in the Enough is Enough law, but we then provide funding for rape crisis programs to provide services on campuses. And we have some fantastic campuses across New York State really doing innovative work. And we also have a number of campuses that are not allowing rape crisis programs on their campus, that aren't reaching out for services, that aren't providing best practices of care. And we need something to, if someone's not going to come to the table voluntarily, then there needs to be some sort of mandate involved that they have to then work with these programs. Because again, at the end of the day, the population that suffers as a result of that are the students and the survivors.
Well, unfortunately, that's all the time we have for this conversation. We've been speaking with Emily Miles. She's the executive director of the state's Alliance Against Sexual Violence. Emily, thank you so much for making the time.
Thank you so much.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.